As you can see on the left of this slide, some of the content that we'll be talking today could be potentially upsetting. Obviously, we're going to be touching on men's mental and physical health and well-being, and there will be some discussion around male suicide. So this is a warning to you about that now. So if you're not comfortable with that, then maybe this is time for you to step back. Having said that, at the end of the talk, our well-being and EDI colleagues are going to be providing you some resources and some further content you can go and approach and see and interact with, which may be useful for you. And there'll be some closing remarks and potential for further support if you need it from our wellbeing colleagues at the end, who are going to stick around for 15 minutes at the end of the presentation. Good. So I'm just going to say a few brief words before we start with Andy. These are, on this slide here, you can see the three themes in the UK of International Men's Day: making a positive difference to the well-being and lives of men and boys, raising awareness, nor funds for charity supporting men and boys' well-being, and promoting a positive conversation about men, manhood, and masculinity. And that's what today's all about. It's meant to be a positive event. But the reason why we're holding it, as you're probably well aware in some of the advertising material for the day, is to consider some of the challenges that men's health and well-being present to us. You're probably well aware about some of the suicide statistics. There's apparently a death by suicide every 2 hours in the UK, which is quite a shocking statistic, and it's a leading cause of death among young people in the 20 to 34 bracket. And in the UK, men are 3 times more likely than women to end their own lives, which is quite a challenging statistic. And the reasons for this are, of course, very complex, and social expectations of masculinity mean that men may be less likely to seek help for difficult suicidal thoughts or behaviours than women. So that's something we want to explore a little bit today. However, in more positive news, the Mind charity, mental health charity in the UK, has found that there has been a positive increase in men seeking help for behaviours and their ability to speak openly about their mental health in the last decade. So that's a positive stat. And of course, at the University of Manchester, particularly in the School of Health Sciences, I'm sure some colleagues from Health Sciences could tell you an awful lot more. If you want to go and look on their website, you'll find a lot about their studies. They've been involved in national studies for decades. The National Confidential Inquiry into Suicide and Safety in Mental Health, NCISH, produced a lot of really informative reports. And the university will point to the fact it's made some positive outcomes. So that is something that the university is quite proud of, and we're very pleased today that we've got someone to come and talk to you about men's health. And so without further ado, I think I'm going to hand over to Andy Romero-Birkbeck, who's going to present to us today. His title of his talk is Empowering Men's Health, Awareness, Action and Advocacy. So Andy, I think I'll stop sharing and hand over to you.
Thank you, Simon. Hi, everyone. Hope you're all keeping well. I'm just going to share my slide deck. Can I get a thumbs up to make sure you can all see that all right? Fantastic. Okay, so just as a quick intro, my name's Andy. I've been working with the university in some capacity for about 10 years now, delivering different sessions. Obviously, we do the wellbeing champions and some manager training. And obviously, men's health, being a guy, this is one of the subjects that I often present on. Obviously, this week, myself and the team, We Are Wellbeing team, we do a lot of talks for a lot of different businesses in and around men's health. And I think I first put this particular slide deck in part together probably about 5 or 6 years ago. And when we started to research men's health, the kind of things that I thought I was going to be talking about was slightly different to what actually came up. So what we're going to talk about in today's sort of 30-minute webinar is we're going to take a look at some of the stats around men's health. We're going to look at the men's health awareness and some of the different key men's health concerns. What are the signs and symptoms? We're going to look at what are the screening opportunities that we might have, and what are some of the signs and the concerns that we might have there. We'll do a little piece around health screening. So that's my background. So just to kind of give you an idea about why I'm somewhat qualified to talk about men's health, apart from being a guy myself. I started out in the health and fitness industry, worked as a personal trainer, taught personal training courses, so I qualified people to become personal trainers. And then I worked for a number of years in health screening, so worked for places like Bupa and Nuffield as a health advisor stroke physiologist, delivering health screening. So someone would come and see me, I'd put them through all these weird and wonderful tests, do all the sort of the physical health screen, pass them on to a screening GP. The GP would then pass them back to me. Then I'd provide evidence-based lifestyle advice based on what we've identified. The challenge back then with health screening was someone would come for one of these amazing health checks, these £1,000 all-inclusive health checks. We'd give them all this amazing information, and then we'd say, right, Mr. Smith, here's all your results. This is what you need to do. We'll go away, and we'll see you again next year. Now, unfortunately, Mr. Smith comes back after a year and nothing's changed. So one of the things that we really want to do is increase general awareness on screening, on how to look after yourselves, but also things like behaviour change are really important as well. So we'll take a look at some of that. We'll look at managing the risk, and then we'll do a bit of a summary in the Q&A afterwards. Does that sound all right? Fantastic. All right. Okay. So when we think about the main men's health concerns, first thing I want you guys to do is just pop to the chat, and I just want you to type in what are the kind of things you think I'm going to be talking about. What do you think are the main men's health concerns before we even get into it? I want to know what your perception is of what the concerns are for men's health and well-being. So we'll get a bit of a record of these and see what we think. Now, so we'll delve into some of those, and this is the kind of stuff that I wasn't quite sure. So I know when I was looking at men's health, and I was thinking, what are going to be the leading causes of concern for men's health? I obviously thought testicular cancer, maybe prostate cancer, bowel cancer to some extent. And I was quite surprised by the results. So when I started to look at and research some of the statistics around men's health, it wasn't what I was expecting. So what we're going to do, we're going to go through some of these. So first of all, with some of these mental health stats, we've got 19% of all male deaths are under the age of 65, which I think is a really, really alarming statistic. When we think about preventative ill health, when we think about premature death, to know that 90% of all male deaths occur under the age of 65. So there's a lot of people that are dying way, way younger than we should be. And we look at life expectancy in the UK, and generally speaking, it's around 84 to 85. A real concern for men's health around that. Then we've ischemic heart disease is the leading cause of death for men in the UK. So looking at heart disease and things that's associated around blood pressure. Obesity, 26% of all adult males are classified as obese. One of the challenges, although many of you will know, a lot of the measurements for obesity are based around body mass index. So there's quite a lot of misclassifications. So body mass index gets a bit of a bad rap in public health, especially. But when we look at public health, we don't have an epidemic of bodybuilders or rugby players walking around. So actually, most people who do have a high body mass index have a high BMI as a result of increased body fat levels. So it's a useful tool for measuring public health. Lung cancer is a leading cause of death, cancer-related death in males. Prostate cancer being the second most common cancer in males. Suicide is the leading cause of death in men aged 35 to 49. It's also the leading cause of death in under 35-year-olds generally as well. And 3/4 of all suicides are men, and it's the biggest killer of men under 35. So one of the things I was more concerned with is that actually we are doing a lot, and we had this conversation on one of the training courses yesterday that I was doing for the university, is that we're doing a hell of a lot in around the subject of mental health. We're doing a lot more talks around suicide and getting guys to speak up and have these conversations, but it is a real concern still. It's something that we need to persevere with and still encourage more guys to feel open to talk and have these kind of conversations. But it's exactly the same with prostate cancer. I've never been sat in the pub and overheard two guys talking about prostate checks. So one of the things we need to do is encourage blokes to sit around and talk and have these conversations and be more open about the kind of things that are taboo subjects. Because quite often, from a health screening background, we often only see people going for health screens either when it's got to a progressive state, or they've had a scare from somewhere else, where this could be someone who's had a father or a brother or a cousin or someone close to them that's had a case of something like prostate cancer, and that's prompted them to do it. But one of the things we want to do from a health perspective is encourage proactivity, encouraging people to go and get screened, to be more aware of their overall health and well-being. So one of the things I looked at when I started to research health and well-being and men's health in particular was the primary, secondary, and tertiary causes of premature death in different age ranges. So I think one of the things that was useful to be aware of is what are the different health and health concerns really for different decades. So we can see here in under 30s or under 50s, sorry, the leading cause, the primary cause of death is going to be suicide or injury, which I think is quite alarming. When we think about suicide and injury, it's completely preventable. You know, these are not people who are dying of old age. These are completely preventable deaths. Then we're looking at age 50s to 64, we'd start to see an increase in heart disease up to 80, and then dementia and Alzheimer's over 80. We know that lung cancer is still fairly prevalent between 50 and 80-year-olds. However, that we expect that to start to decline as younger generations are not smoking as much tobacco. We've got things like heart disease as well. Under 35 to 49-year-olds is a secondary cause of premature death, and you think about heart disease as being more of an older person's concern. I'm 40 in about 2 weeks, so I'm thinking if I'm smack bang in the middle of the age range of somebody that's, you know, the secondary cause of death might be heart disease. That starts to become a concern. Not so much of a concern that I want my blood pressure to go up, but it's something that I should be more aware of. So a lot of this, when we start to look at some of these health concerns, the thing that I was surprised by more than anything when I started to look at these primary, secondary, tertiary causes, there's no mention there of testicular cancer. There's no mention there of prostate cancer. And it's not to say that they're not of concern, but when it comes to men's health, these are the things that we should be, you know, more aware of, or at least pay some attention to. Now, what we're going to do then is going to go through each one of these different slides and take a look at some of the risk factors, the signs and symptoms, and some of the screening opportunities. So as far as mental health being a major concern, some of the major risk factors is with age. So we can start to look at some of the demographics around poor mental health. There's a brilliant, I've not got it on this particular slide deck, but there's a brilliant graphic of it's almost like a heat map of the UK that looks at where are men more likely to die by suicide, and we see much higher increased risk of suicide in the north, so in Yorkshire, highly increased in the northeast. So when we start to look at some of these trends, and obviously look at these trends within organisations, we can start to think, well, actually, what are some of the things that contribute to somebody being more likely to die by suicide or experience poor mental health? So age can be a contributing factor, being under certain amounts of stress. So stress can manifest itself in a lot of different ways. Trauma, lack of support, family history, much more likely to experience poor mental health if you've got family history of poor mental health. Signs and symptoms. One of the things we were talking about in some of the training that we did already this week, I don't particularly like to focus on signs and symptoms when it comes to poor mental health, because when it comes to signs and symptoms, the signs and symptoms can be physical, emotional, behavioral signs and symptoms. It can be cognitive changes. But there's a vast amount of signs and symptoms. There's loads of signs and symptoms. Everybody you know could potentially display different signs and symptoms. There's a lot of crossover. So the physical signs and symptoms of stress are often very similar to the physical signs and symptoms of depression and anxiety. So there's a lot of crossover there. And the other thing is, if somebody is just going to display signs and symptoms of stress, anxiety, and depression, quite often there is still this stigma associated with it. So people will go to great lengths to try and hide it. Now, one of the reasons why I'm really passionate about talking about well-being and mental health, and especially suicide prevention and intervention, is unfortunately I've got 3 friends who have died by suicide. All of them were under the age of 42, and all 3 of them came as a complete shock. There wasn't any obvious signs and symptoms in the people that I know. So one of the things that I think is important is not placing too much emphasis on signs and symptoms. A useful way of thinking about this and all the other things that we're going to talk about in today is what we call the observation of change. And the observation of change is a really, really useful health indicator. So if I took you for a health check and you went to see Dr. Sam after you'd seen me, one of the first questions Dr. Sam would ask you is, what have you noticed that's changed? whether it's a lump, whether it's a bump, whether it's a change in appetite, whether it's a change in digestive habits or digestive issues, if it's you get headaches when you didn't previously get headaches, the observation of change is a really useful indicator. And it's also really useful to apply that to the people that you know as well. So if you're noticing something that's out of character, something that's out of the ordinary, it doesn't have to be an obvious sign or symptom, but often change can be a really useful thing to predict or to prompt you to ask a question. When we look at screening for mental health, we've got generalized anxiety and depression screens where we can do a questionnaire to identify the level of someone's risk of having anxiety or depression. Going to the GP is a really useful, we'll talk about this in our training course as well, but going to the GP is really useful because you could have obvious signs of something that might seem like depression. You might have lethargy, you might have low mood, you might, energy levels will be plummeting. You could have something like that that might seem obvious to be something like depression. You could go and often have a load of counseling sessions with somebody and make no improvement. And the reason why you could have not made an improvement could because it could be something like an underactive thyroid that was causing that. So even if you suspect something as being poor mental health, it's still really useful to go and see a GP and go get a blood test, because a blood test might outrule any underlying health conditions that might be worth checking out. So just generally, useful practice. But obviously then we've got things like counseling, clinical psychology, medication to some extent. Medication, things like antidepressants are really well evidenced. So when prescribed by something like a clinical psychologist, can be a really useful part of the mental health sort of healing and managing process. Ischemic heart disease. Again, this is one of the big health concerns, not just for men, but for women as well, but in particular guys. Major risk factors, things like age, stress, obesity, poor diet, family history. So this is this buildup of fatty plaques in your arteries. So this image, you might have seen something similar to this on the right-hand side. So we refer to this as the process of atherosclerosis, which is this gradual building up of plaques over time. This isn't something that happens overnight. So if you have a burger for your lunch today, you're not likely to have a heart attack an hour afterwards. But it's this gradual buildup of whether it's through high blood pressure, whether it's through a buildup of cholesterol over time. But generally speaking, useful things to be aware of when it comes to heart disease is every year we do this campaign of know your numbers. Now you should all, hopefully, I'm going to hazard a guess that most of you don't, but you should ideally know what your blood pressure is. You should ideally have an idea what your total cholesterol is, or in an ideal world, you know what your breakdown of your cholesterol is. So some useful things to have without going down the full route of serious health screening is simple things like a blood pressure test and an annual or every alternate year a lipid profile. So a lipid profile will give you your total cholesterol, your LDL cholesterol, your HDL, your good cholesterol, your triglycerides, and then a ratio of the bunch. So they're useful things to have. Often with signs and symptoms of ischemic heart disease, often it's nothing. Sometimes the first sign of a heart attack or a stroke can be the heart attack or stroke that kills somebody. So often there's no obvious signs or symptoms. Other mild signs and symptoms can be things like chest pain, shortness of breath, dizziness, palpitations. But being a guy myself and knowing lots of other guys, we typically, stereotypically, we're not that good at paying attention to those signs and symptoms earlier on. We often wait until things get bad enough that we think, oh God, I can't carry on with this. I better go see the GP. What's really useful is going and being proactive with your health and well-being. Whether it's going and getting a blood pressure cuff yourself, always recommend to people, have a blood pressure cuff at home. You don't want to become obsessed with it and turn yourself into part of the worried well. But what's useful is to just understand what your blood pressure is at rest. So if you lay down on the sofa, get on your couch or lay in bed and lay there for 5 minutes and then put the blood pressure cuff on and hit go. The automatic ones are brilliant because it gets rid of human error. And then understand what your blood pressure is at rest. Because if your blood pressure is high when you're laying in bed or laying on your sofa, you've got to consider then what's it going to be like when I'm at work? What's it going to be like when I'm under pressure? What's it going to be like when I've got those work deadlines looming over me? So taking a look and being, proactive and responsible over your own blood pressure is a really, really useful thing. Other screens that you can obviously have things like an ECG, an electrocardiogram, things like exercise stress tests. if you're quite fit, and that's quite often one of the things that we used to do in health screening is put somebody on an exercise bike and look at trying to understand what their blood pressure response to exercise is. And we often find that people will have a normal blood pressure at rest, but the second they start exercising, it skyrockets. But that would never get found out unless you do an exercise test. So doing things like that can be useful. And if you do have any major concerns, there's some brilliant clinics that do things like artery scans now. We work with a couple of different ones here in Leeds, and they do some really good stuff. And I think the key with any kind of screening is you don't want to be to develop health anxiety and be worrying and overly concerned. But if you do have a concern, making a conscious effort to go and get that checked, whether it's through a GP or a private clinic. Lung cancer, again, one of the leading causes of cancer for death in men in the UK. Risk factors is obviously if you're a smoker, passive smoking, environmental factors can play a big part in this. Pollution and being presented to by radiation or pollution. Signs and symptoms: coughing, chest pain, shortness of breath, weight loss, and fatigue are all some of the kind of the obvious signs and symptoms. And as far as screening, standard screening will be something like a chest X-ray, a low-dose CT, a bronchoscopy, so having a camera down into your chest, and then if needed, be a biopsy and a simple test, a really basic test that we can also do, something like a lung function. So the most basic would be something like a peak flow that we look at for somebody who, when we test for asthma or the management of asthma, but even doing things like a lung function test where we look at the volume of oxygen in your lungs, and also then looking at the force of oxygen and how much you can force the air out is also a useful indicator as a primary test. So there's lots of useful screening in around lung cancer. Prostate cancer, again, this is one of the big ones that we see a lot of demand around, partly because it's in a sensitive area and guys don't typically talk about prostate checks. Some of the risk factors around prostate cancer, likelihood increases with age. If you're a smoker, that can also increase your risk. Same with obesity and being overweight. If you've got a historical poor diet and family history, they are all things that can increase your risk of developing prostate cancer. Signs and symptoms then can be on any kind of change to the flow of your urine. So whether it's urgency, whether it's increasing frequency, whether it's in hesitation and struggling to pee. So just noticing some changes in the flow. Also things like blood in the urine, but it can also be another sign can be blood in the semen as well. And paying attention to those. Any kind of erectile issues, whether it's difficulty getting an erection or whether it's a painful erection as well. Not being able to sustain, they can all be early warning signs. Any kind of pain in the groin area, and also then fatigue. And then there's a range of other kind of signs and symptoms, but that's kind of the main handful. Again, the challenge is a lot of prostate cancer diagnosis doesn't happen until the later stages. I know a number of guys who have been impacted. In fact, my old office. The block that I worked in was called Lloyd Pinder House, and it was named after Lloyd, one of my colleagues who unfortunately died of prostate cancer. You don't get offered a prostate cancer check, so like a digital rectal exam, you don't really get offered one on the NHS until you hit 50. Unfortunately, Lloyd died, I think it was 47. So one of the things that, I'm just about to hit 40 and I've been for 2 of these screens already. Not because I've been written to by the doctor, just because I want the peace of mind. So for me, and I'm not urging everybody to rush out and go and panic, don't panic by going for digital rectal exams, but definitely, being proactive, not waiting to get written to by the doctor, because unfortunately the NHS is pretty stretched and the consistency of being written to and get offered these well-manned health checks is really inconsistent. So don't wait to get written to. Take matters into your own hands, and if you've got any concerns, go and get screened. If you have any of the signs or symptoms above, don't wait till you're 50. A lot can happen before you hit 50, so go and get those checks sooner rather than later. The earlier, with any kind of cancer, the earlier the detection, the better the success rate. So we've got a PSA, a prostate-specific antigen. That's basically a blood test. So that's just looking for a marker in the blood. We've then got a DRE, so it's not Dr. Dre, it's a digital rectal exam. But if Dr. Dre helps you remember it, it's probably a slightly more pleasant way of thinking about it. You can then do ultrasounds. So there's some really good clinics now that can do ultrasounds on the prostate to look at the density of the prostate, not just the size and the feel of it. And then obviously, if there was anything suspicious, it could be a biopsy. At a baseline level, we can also do things like urine analysis to try and look for the presence of blood within the urine. When you talk about blood in the urine, it's not just about being able to see it. Quite often, if there's blood in the urine, if there's a trace of blood in the urine, you won't see any discoloration at all. So even things like the dip tests, if you have a real concern, you want to just check in with your health every now and again, even those urine dip tests can be a useful thing. My only reservation about home testing is it can lead people down that pathway to becoming part of the worried well, where you become health obsessed and can start to develop health anxiety, worrying that things are not quite right. So it's always useful to tie this in with some sort of medical professional. We've got testicular cancer as well. So the main concern here would be undistended testicles. So if testicles hadn't dropped, if you've contracted HIV, that can increase risk of testicular cancer. It is more of a young man's cancer, so anything between the ages of 20 to 34. If you've had a prior cancer, that can increase risk, and also family history as well. Signs and symptoms then. This is an interesting one because I've asked a lot of guys this, and I don't know if this is the same for everyone else on the call. Nobody ever teaches you how to check your testicles. No one's ever sat down with me and told me, as a 20 to 34-year-old, I'm out of that age range now, but no one ever sat down and taught me, how to check your testicles, what to look out for. And maybe that's something that we do need to do. Maybe that's something that we do need better education in and around on how to do a self-assessment. So it's looking for any lumps or a lump or lumps, any kind of changes in size of the testicles, a general feeling of heaviness in the scrotum, dull aches or pains, or enlarged lymph nodes around the testicles can be a primary indicator. It's worth saying, you could also experience any of that kind of stuff for something that's completely benign, that's not cancerous. And actually, most lumps that are found on the testicles are actually a cyst. So if you do find something, you don't have to go panic mode, thinking that you do have testicular cancer. But what you should definitely do if you notice anything is get yourself to your GP, get a GP to check your testicles, and then what they'll probably do is do an ultrasound. So put some of the petroleum jelly on your testicles and then just do an ultrasound just to look at the density of whatever it is that is that lump. So as far as screening, self-assessments are really useful. So checking your own testicles, don't do it when you're cold, do it when you're in the shower, you're warmed up, you're in bed, body temperature's increasing, your scrotum's a little bit looser. Obviously, doctor assessments, your ultrasound, blood markers, and then biopsies as well. Another thing that's really interesting about men's health and stuff here in the UK is when it comes to liver disease, you typically have fatty liver disease and you've got alcoholic liver disease. In the US, in America, they have huge levels of fatty liver disease through typical poor diet. In Eastern Europe, tend to see high levels of alcoholic liver disease. In the UK, we have both. So liver disease is a real concern. So things like if you are drinking a lot, if you have an unhealthy relationship with alcohol, trying to, if you're going home and having, you got a bottle of wine or a glass of wine and your beers because you're stressed, one of the things that's really useful. I do a lot of work with the alcoholic drinks industry, so I'm not advocating abstinence, but what's useful is to consider your relationship with alcohol. And that's part of it. So things like looking at your diet and looking at your relationship with alcohol is useful as well. Obesity, again, we know that a quarter of all adults will be measured as obese. And this is not just the concern with obesity itself, it's the other health conditions that are tied to it. So things like an increased risk of type 2 diabetes, increased risk of coronary heart disease, increased risk of stroke, certain cancers, metabolic syndrome, and things like increased blood pressure. All of these things are heightened if you become overweight or obese. Now, it's an interesting subject because when we think about the benefit of things like body positivity. Absolutely, that should be the case. We want people to feel comfortable in their own skin. However, when it starts to have a negative impact on your physical health and potentially your mental health, it should be something that we talk about. Now, we talk about the stigma of poor mental health. I do talks all the time on mental health. I reckon in the last 10, 12 years, I've only done 4 or 5 talks on obesity because it's a real sensitive subject. But the challenge is, if we're not talking about it, people are not going and getting credible recommendations from evidence-based studies. You know, we did a study recently. We did a survey recently within the drinks industry, and we asked the question, where do you go to stay informed about your health and well-being? And the majority of people said that they go to Instagram. Now, those of you that work in health and well-being, that's a real concern. If most people are going to Instagram for advice on how to manage their health and well-being, there's a really good chance they're going to be getting a lot of misinformation. So one of the things we want to do, especially at work, is provide people with access to the credible resources. So how to maintain a healthy weight, what healthy weight management looks like, they're all really, really useful things. Another interesting and sort of divisive subject is andropause. This is one of the ones that sometimes we kind of bring this up and sometimes we don't. Unhelpfully, it often gets labeled in the media as the male menopause. I'm not particularly a fan of calling it the male menopause, but what we do know is over time, there is this gradual lowering of testosterone in guys. That as a lower testosterone level can lead to things like depression, loss of sex drive, erectile dysfunction, other physical and emotional symptoms. Now, I think one of the things, and this is just a fleeting thought, it was something for you guys to consider, not a big evidence-based backing around this. They do a lot more around testosterone therapy in the US, but not so much here in the UK, catching on a little bit. But one of the things we know is that guys are more likely to die by suicide and experience poor mental health close towards the age of sort of like 45 to 55. And if we coincide that with this lowering of testosterone, where, you know, testosterone is often the thing that makes a guy feel like a guy. And maybe there's something there. Maybe that's an area of study for the future. But I predict that we'll hear more about andropause in the future as a subject in and around men's health. Hopefully not just a money-making opportunity for farmers to sell a load of testosterone, but we will see. I'll just put it on your radar. So as far as health and wellbeing screening, we get diabetic eye screening from the age of 12. So when you're going for your regular eye test, it's useful not just to check your vision, but also to check for risk factors of diabetes. You can actually do online heart age checks over the age of 30. So if you are over 30, checking out like the British Heart Foundation doing a heart age check is a useful thing to do. Bowel cancer screening from the age of 54. However, it can be somewhat inconsistent. So generally it's more regular over the age of 60, but it can be from the age of 54. And then when you hit 40, so I'm on tenterhooks because I'm going to be 40 on the 27th. So I've been talking about this for years. I'm waiting to see if I get offered a well man or I won't get offered a well woman, hopefully, but a well man health check. And you should get offered these at 40, but it seems to be pretty inconsistent, depending on the NHS trust that you live within. So if you don't get written to by your GP to get offered a well man and you are over 40, one of the things I would do is approach your GP and ask them for a check, because within that well man health check, you'll get a well man blood test. So you'll get a full blood profile done. You'll get an ECG, and you'll also get a PSA. You should get prostate specific antigen. They won't necessarily do a digital rectal exam over 40, but they will do that over 50. So that's worth checking as well. And then over 65 dementia screening as well. So as far as managing risks, this is a very similar slide to a lot of the things when it comes to health and well-being. It's doing the stuff that you know that keeps you well. So things like drinking plenty of water, maintaining a healthy weight as best you can, going from regular medicals and checking the things that need to be checked, eating a healthy and balanced diet, adhering to good standards of hygiene, and then being physically active, bringing all of those things together. We know that it's difficult to manage all of that all the time. but endeavouring to do that is really useful. And I know for a fact that the university has loads and loads of really useful resources, whether it's through Health Hero, the EAP, whether it's through all the stuff that I think Maisie is going to talk about in a minute. So that's me done. I've set a timer. It says 30 minutes on it. I was asked to do 30 minutes. Very professional. Any questions?
Perfect timing, Andy. I think it's open to the Q&A. So if anyone's got any questions, I'm hoping that Molly and Natalie can fish them out from Slido, or you can put your hands up. I think we can do a virtual round of applause for Andy as well, can't we? Let's see if we can figure out how to do that. There we go. That's me.
I appreciate that. Okay.
And I was a bit rude because I forgot to give you your We Are Wellbeing company organisational plug at the start, Andy. But if you want to say a few words, you're welcome.
Well, I think a lot of you might have come across us before because I've obviously been working with the university for a number of years. But yeah, essentially what we do is education. So training courses, workshops, and seminars. We have a pretty good calendar of stuff. So at the minute, all this year, I've been doing, you might have seen me on one of the managers training courses that we've been doing, or on our wellbeing champions courses. If you work in a department where you don't have a wellbeing champion, put yourself forward and have a look at the next course and try and get yourself signed up to become one of our wellbeing champions. That'd be really good. But thank you, Simon.
Thank you, Andy.